Bum 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 ba-dum bum 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 ba-da-da-dum bum bum ba-da-da-ba-dum. Rum bum 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 ba-dum bum 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 ba-da-da-dum bum bum ba-dum ba-ba-dum. Hello, my friends. It's so great to see you all. I love to watch you coming in. Kentucky, and that's April and Pat from Tennessee. And what I love what Donna said, welcome all new people here tonight. I love new people coming in. And I also love my old friends who've been with me for many years. It's so good to see everyone coming in. So for those of you who are new, my name is Joette Calabrese, and I'm here every Monday night to do one thing and one thing only, and that is to teach you homeopathy. And tonight we're going to do something a little different, even though we're talking about alternatives to antibiotics, but I'm going to teach you a really interesting remedy tonight. And for those who already know me, hi friends. It's great to see you all. So I'm seeing Denise. Okay, not sure where to get info. I need to self-disband, treat myself. Yeah, this is it. This is a good place to start. Very good place to start, my dear. This is, I live in Delaware, says Denise, and I'm not sure if I have to adjust the time of the meeting. No, Delaware, this is Eastern time. We always use Eastern time because I'm on the East Coast as well, or close to the East Coast. Hello, friends from Grand Rapids, Michigan. Good evening from Southern California. Now, they're three time slots away from us. Hi, Noreen. Hi, Neely. Old friends from my classes, from the academy, from Mastermind, from Mastery. These are people, many of the folks who are here today are students of mine who have been through many of my courses and into my academy, and then the mastery program as well, which is the follow-up to the first year of the academy. And I'd love to see you all. Howdy, teach. I know that's always Neely. She always says that. Hi, Neely. So, my friends, we're talking about alternatives to antibiotics. And I do have an entire course titled Alternatives to Antibiotics. And you can find that by going to Joette's Learning Center, Joettes, no apostrophe, Joette's Learning Center. But I want to give you something that I'm not even sure I gave you. I'm not sure that for those of you who have taken that course and who have taught the course, many of you I see here who have been with me for a long time have actually taught my course to groups of students online and in person. Tell me if I've talked about this medicine. I'll tell you a little bit about it first and see, for those of you who have been studying materia medica, see if you can guess what this medicine is, because it's a lesser known remedy, as they say. It's not one of the more common ones. So it is used, we could call it an alternative to an antibiotic, and it's specific for infections of the throat, the lungs. The lymph nodes are often swollen. It can be an infection in the mandible. More often it's lungs. And interestingly, this medicine is used by farmers. And the farmers use it for livestock, especially for the lungs of cattle. It's so fascinating because, of course, homeopathy has every ability to treat animals as well as humans, as well as plants. Yes, indeedy. Yes, that's really so. Pat from Kansas says, Hippozenium. Well, you're absolutely right. Hippozenium is a great remedy for the areas that I'm talking about, right? But this one's a lesser known medicine. This is, it begins with the same letter, begins with an H. It does not repertorize out very well. If you look up certain infections in the repertory, it shows up, but not as often as you might think. And it's a medicine that I learned about many years ago from one of my teachers from India. It was Dr. Ramakrishnan. And Pat says, I'm also taking antibiotic alternatives right now. Well, it'd be interesting to know if you happen to come across it. So I'm still not going to tell you what it is yet. I'm going to tell you a little bit more. I want you to learn about it first. Infections of the bloodstream, septicemia, indeed. Chronic infections, pulmonary infections, of the lungs. Often they're localized infections. Of course, bloodstream infections are not really what I'd call localized. But it also has to do with the sinuses, sinus infections. Hyper R, says Marlo, good choice, but that's not it. You're right, it does begin with an H. Hyper R's, Hypericum mixed with arsenicum is a Banerjee protocol. This is not a protocol. And what I mean by that, we don't have a specific statement made on this is the remedy, or excuse me, this is the condition, this is the remedy, this is the potency, and this is the frequency. This one's different. I'm just going to teach you all about this medicine and see if you can figure out how it might be used. So glands are swollen, painful. There are abscesses. Abscess is common, and even an abscess on the pancreas. Now, I've never taught that before. Abscess on the pancreas. So it can be for acute and chronic conditions, but it can be a long-standing infection, an infection of, say, an abscess on the pancreas. Hydrastis, says Maria, good, so great. I love what you guys are doing. I love it. You're so good. Hecla lava. Well, you're right about Hecla lava when it comes to the mandible or the maxillary, right? That's what you call all the H's. You're so good. Pat from Grand Rapids says Hecla lava too. I think it's going to really stump you unless you've really gone deeply into this. So abscesses in the spleen, swollen inguinal glands, submaxillary glands can be swollen. Tonsils can be abscessed. I know this is an interesting. There's great fatigue, prostration. Chronic rhinitis. It can also be for rhinitis. It doesn't have to be an infection in the sinuses or the nose in that area, but it can have chronic rhinitis. We use it. I like to use it in the 30. I used it years ago, and then I kind of got away from it. You got it, Beth. You got it. Hippozenium or Hippozenium. I'll spell it. You got it, Beth. Beth who? Who is this Beth? You got it, Beth. I think I know which Beth this is, but let's see. So Hippozenium is spelled H-I-P-P, like hippopotamus. H-I-P-P-O-Z-A-E. A-E-N-I-N-U-M. Hippozenium or Hippozenium. Yes, just wrote that down today. Oh, says Pat. Beth, yeah. Beth in what? Massachusetts? M.A. Massachusetts. Good job, Beth. Good job, Pat. You just wrote it down today. I know. Isn't it fun to learn this stuff? I learned this from Dr. Ramakrishnan, and he felt that it was one. He gave us two medicines that he thought were the antibiotics used in homeopathy. And this was one of them. And I'll tell you what the second one is as well. Actually, he gave us three. But I want hippopotamus for Christmas. Infections of soft tissue. That's right. So that's why the glands, right? Could also be, though, could be in the mandible, could be in the maxillary, could be in a bone. Yes, indeed, it could be. It's such a great remedy because it's such a fun remedy to say. Hippozenium is the full name in Latin, or it could be called Hippozenium. That's how it is in homeopathy. We often use names of medicines with an elongated term, which is Latin, and then the not so long. Where in Mass, Beth? I'm near Springfield, says Catherine. I like when you folks do that. I want you to know each other. I want you to help each other. Christy got it. Hippozenium, yes. Pyrogenium, says Alice. You know what? Pyrogenium is so close to this, Alice. You are so right. Pyrogenium is also a very close remedy to Hippozenium. Let's see if anyone else got it. Bubonic plague. Oh yeah. Oh gosh, bubonic plague. Yeah. For Pyrogenium, says Tammy. Oh, wait a minute. Vidya. Hippozenium. You got it. Vidya got it. Bhattacharya. Yes, you got it. See, some of you. Hyperself, says Tammy. These are all good choices. Hyperself. Hydrastis. Yep. Here we go. Hypericum. Isn't this fun? I just love this. Marastica, Echinacea, Mullen. Okay. Okay, now we're going way, way back. Christy got it. Yeah, a couple of you. My daughter has a collapsed lung lobe autoimmune disorder from years of whatever drugs. Well, it's not just, it is for an infection generally. This is a remedy that has the relationship with an infected aspect. So the lungs are infected. It could be bronchitis. It could be pneumonia. It could be pleurisy that's related to an infection. Abscesses, a lung abscess, bronchitis. Bronchitis in the aged. So for people who are elderly and get bronchitis, with dyspnea. Dyspnea is inability to breathe, not getting enough air. Soft tissues around the periosteum. You're absolutely, yes. Periosteum is around the bone. It's the encasement of the bone. This antibiotic course is amazing, says Pat. Yeah, it's very thorough. Thanks for saying that, Pat. It is a very thorough course. But I do want to know, I don't remember if I put Hippozenium in there. And I want you to compare this medicine to medicines such as Pyrogenium, Hyper-Ars, Hypericum, mixed with arsenicum, the Banerjee protocol. I want you to also consider Basilinum. Basilinum. Because Basilinum is all about the lungs and infections of the lungs, right? So that's where we're going with this. And Sorinum. Sorinum is spelled P-S-O-R-I-N-U-M. P like in pneumonia. P-S-O-R-I-N-U-M. Sorinum is a really good medicine for long-term infections, long-lasting infections. Infections, let's say, in a bone that's been going on for a long time. Years and years, even months or years. Bone infections tend to do that, which is why antibiotics are used over and over and over and over in osteomyelitis, my friends. But it is very rare that they can actually clear up a bone infection. What they usually have to do is amputate, and then amputate again, and amputate again, because it's almost impossible to clear up a bone infection with conventional medicine. Remember that, my friends. Remember that. Hippozenium, Sorinum, and Basilinum are all no-sodes, so 200C, a no-sode, so 200C. Actually, I use it in a 30. Doesn't mean you shouldn't use it in a 200. I use it in a 30. I'm not using it as an auxiliary, as sometimes we use it in no-sodes. I'm using it as the medicine specific to the condition. Pneumonia, bronchitis in an elderly person. Specific to the person, osteomyelitis that's ongoing. See where I'm going? Basilinum is spelled B-A-C. It's B-A-C, not B-A-S. But you can look it up. You'll find it. I also want you to think of Kelly bicromium, because and why Kelly bicromium? I want you to compare it to that, because this Hippozenium or Hippozeninum is often in the sinus cavities, and so is Kelly bicromium. So we're going to compare those. They did that, my dad, antibiotic, and they killed him in the end after being on it for 2 years. Oh, my gosh. I know what you're talking about. That's with the bone infections. They just keep going and going, and they do not tell you up front, it's not likely we're going to get to this. Why is that? Why can't we get to a bone infection using antibiotics? Or why is it so difficult to get to a bone infection with antibiotics? Because there's no vascular system, or very mild or very minimal vascular system. There's no blood that goes to the bone. So the blood has to carry the antibiotic into the bone. But with homeopathy, it doesn't go through the bloodstream. It goes through all the tissues. It's a completely different delivery system. The model is completely different. So we needn't actually have it go through the bloodstream. Sometimes a remedy will act just by placing it on the wrist if need be, or just by putting it, touching the mucosa of the mouth. It hasn't gone into the bloodstream yet. It's only a minute or half a minute, and sometimes we see a shift within that much time. Basilinum, Burnett. Yes, thank you, Jennifer. You're right. Dr. James Compton Burnett. If you are not one of my Joette's Mighty members, you may not know so much about Dr. James Compton Burnett from the 1800s, one of the greatest homeopaths, great literature that he's put together. He was a conventionally trained medical doctor, worked in a hospital, and worked with many, many, many patients, thousands of patients, and that's the kind of doctor we trust. That's the kind of homeopath we trust, because we don't want someone who has kind of a theory that's kind of interesting and fascinating. No, we want someone who has seen thousands, who has clinical experience that is so big that it's almost incomprehensible. Usually only one dose, only a week of these no-sodes. Well, I don't know. When it comes to this, if there was someone who had what did we just say? Bronchitis in the elderly, I would not give it once a week. Bronchitis is serious. We need to move faster. I would not wait. If somebody has a lymph node that's swollen, I would go a little faster. Generally speaking, you're right, Jennifer. We often use no-sodes once a week or once every 2 weeks, but sometimes we don't. Sometimes we don't. Tuberculinum is used daily in certain gut conditions. So that is a general rule of thumb, and I'm glad you know that. But also know that sometimes we step outside of those patterns from time to time. But you're right, Jennifer, and that's why you said usually. So you hit it on the mark. Okay, so that is one of our great medicines for sinus, bones, lymph nodes, abscesses, lungs. Lymph nodes, that is chronic tonsillitis, abscess tonsils. And so would you use it? How often would you use Hippozenium? Well, it would depend on how serious the condition is. If somebody it's an elderly person with bronchitis, I'm going to use it twice a day at least, maybe even 3 times a day for the first few days. And then we taper off, as we always do in homeopathy. For those of you who are new, I want you to know that I'm going to remind you, these are not supplements. They're not vitamins. They're not herbs. These are medicines, regulated by the FDA as drugs, as medicines, even though they're not synthetic and they're not patented. They are medicines. So we use the medicines until we see that it has done what it's supposed to do. Now, sometimes it's more complicated, and you really need to study some. But sometimes we can really get to the bottom of this in very short order. So I don't teach a course specifically on no-sodes because, my friends, no-sodes are medicines, are homeopathic medicines. Just like sea animals, sepia, kelp carb, are just medicines. Just like cell salts are just homeopathic medicines, and we integrate them in. So in classical homeopathy, often it is separated. You'll learn about no-sodes, and then you learn about sea animals and the medicines made from sea animals, and then you learn about the plant world and plants that are toxic and plants that are foods, etc. I don't categorize. The categories that I use, instead of in the categories of the medicines themselves, I'm using the categories of conditions, because we work with the condition and the symptoms, not the whole person. I used to say that. It's not every person is different, so everyone gets a different medicine. I'm sorry, my friends. Out with the old and in with the homeopathic medicine that actually Hahnemann was using in Paris, which is why he wears a beret. Because when he was in Paris, he determined that we use the condition to choose the homeopathic medicine and the symptoms that are associated with them. He did not consider the whole person, or he may consider it, but he did not count on the entire person. That was a method or a theory that was built around generally Dr. James Tyler Kent in the last century in the U.S. Okay, where do you buy it? Boron does not have it. No, they don't have it, but you can buy it on Amazon and there are certain companies that I trust on Amazon. Boron is one. Who's another one? Redowek is another. Schwab is another. Helios in England, you wouldn't buy them on Amazon. You buy them directly from Helios in England. And believe it or not, from England, it comes pretty darn quickly. If you happen to be a student of mine, or a client of mine, then you can purchase from OHM in Texas. So you can do that as well. Okay, let's see. Excuse me, let me take a sip of water and I'll read some more of your questions and comments. Thompson's in Toronto. I didn't know that Thompson has it. I was just up there. In fact, I'm going back again. I'm going to go visit them again in Thompson's. I like to go to the pharmacies. I've made a point of it. I meet the pharmacists. I look at their facility. I like to watch how they're making the medicines. I think a very important aspect of understanding who we're dealing with. And I support our pharmacies, our homeopathic pharmacies. All right, let's see if we have any other questions. Yes, please, everyone. Like, comment, share, and plan to teach your children this. Joette, you have helped our family so much. Yes, thank you, Amy. I know it's helped my family too, but blood pressure went high. Weird, age 60. Okay, I think there's a discussion going on. Merry Christmas, Joette, and everyone says Dee Dee. Yes, Happy Advent and Merry Christmas. I have bronchitis, not sick other than shortness of breath. Well, so then we use a medicine that's specific for shortness of breath. And so you can easily look that up with breathlessness in if you look that up in my blog, you might find it, but there are going to be people who are going to help you. E. coli infections are often very stubborn too, says Alice. Reduce blood flow. Oh yeah, we're talking now, Cassandra's bringing up reduce blood flow in the bone, which is why it's so difficult to treat bone infections, osteomyelitis with antibiotics. Oh my goodness. Goddess Val, I do wish I knew about homeopathy before. Part of my 5th metatarsal bone was surgically removed last year. Well, let me just tell you, anytime that we see a bone that has gotten infected, even with surgery, I would watch very closely because a tooth is extracted and we assume everything is just fine because we don't feel anything, we don't see anything. It doesn't show up so well on an x-ray unless you're highly trained. And then you find out years later that the bone has been infected all that time. So we automatically, in that antibiotic course we were talking about earlier, I discussed that pretty thoroughly. And we use these homeopathic medicines specific to an infection in a bone to prevent the possibility after surgery. So after a wisdom tooth extraction, we automatically use the homeopathic medicines specific for infections there. What are those antibiotics and homeopathy? 3 medicines from Dr. Ramakrishna. Okay, so let's go back. Thank you. She's on, so refresh if you need to. Okay, the next one that he talked about was a gunpowder. Gunpowder. Now, doesn't that sound strange? Really? Gunpowder? Well, yes, my friends. Gunpowder is made of 3 separate compounds, or it's a compound of 3 compounds. Let's see if I can remember what they are. Saltpeter, sulfur. I forgot the third one. And it was found during the Civil War that homeopathically gunpowder was a great medicine for infections similar to the infections in which Hippozenium or Hippozenium can be used for. So gunpowder is also a great one. So I urge you to read up on that. So garden variety gunpowder, and I would purchase it in a 30. That's how I would use that. And that's also for soft tissue infections. It was used for bullet wounds after the bullet was extracted. Let's see. And, okay, so they're still asking. Used in World War I and II. Yes, that's absolutely so. It was used in the wars because there were homeopathic medical doctors in the fields. So you prefer Hippozenium for bronchitis when there is an air hunger and elderly, correct? Gunpowder works great for jaw infections for me, says Tina. Yeah, that's a good point. So I don't know that I would prefer it. I'd want to make sure that it was indeed correct. But if it's an elderly person and they have bronchitis, I would very strongly consider it. Read up on it. Read as much as you can get on this medicine and see if it fits in any other ways, particularly if there are lymph nodes that are swollen, but it doesn't have to be that You don't have to see that occurring. Okay, the third one is Pyrogenium. And Pyrogenium, we've talked about before. It's a beautiful medicine made from beef that has been spoiled. And I know this also, for those of you who are new, it sounds disgusting, but that's the beauty of homeopathy. They get something that is very toxic and dilute it. They, meaning the homeopathic pharmacy, regulated by the FDA, by the way, if they are homeopathic pharmacies regulated. If they are indeed a true pharmacy, they dilute it and succuss it, and dilute it and succuss it 200 times to the 100th power, or 30 times to the 10th power, etc. And that's what makes for a very valuable antibiotic. These are, and that one, that Pyrogenium is a great medicine for when there is a fever from an infection. Now, it doesn't have to have a fever, but it's great for sepsis, septicemia, blood poisoning, etc. Gunpowder is great as an oral wash and knee replacement. Yeah, knee replacement. Yeah, those surgical procedures, hip replacement, my friends, I would definitely use these medicines, not just this, but those that I teach in the antibiotic course as a preventative. Because again, what's the likelihood that there would be an infection? It's a high likelihood. It's a high likelihood, my friends, because when you open up the body and expose it to air, you cannot make a sterile room. It's impossible. I mean, there are microbes everywhere. So that it is important that you have these medicines on hand just before perhaps the surgery, if you know that there is an infection and that's going to be debrided, for example, and after the surgery for several days, sometimes even weeks. Oh, Wendy says Pyrogenium is good for cat bites. Yes, it is. Yes, it is. Pyrogenium 30 or 200. I often use it in a 200, but I've used a 30 as well. Which remedy for knee replacement? Well, if there's an infection, then you're going to use according to how it's presenting. So that's why when I say it's not person-specific, it's condition-specific. So if it is indeed an infection from surgery, then we're going to use how it's presenting. If the lymph nodes are affected, of course, we're going to work closer to Hippozenium. Hippozenium, both pronunciations. What's a good remedy for lost voice during a cold? How about lost voice from speaking too much? Too dry. Alrighty. My 2-year-old has suffered from molluscum contagiosum. Used your protocol, and she was healed in less than 2 weeks. Yeah, it's the way this works. Fast. Now you don't have to worry about it any longer. No, what was the second antibiotic? Ramakrishna told you. I went through them. I think you know now. I already just said it. My dad had an animal valve put in heart, probably porcine, 2 years ago. Went to the dentist, only took 2 pills instead of 4 penicillin, had a backache in hospital 2 weeks, said he had infection in the back. Had antibiotics by port for 30 days straight. Now he has to have a pill daily because his back kills him. He's 89, no cure. Wow, that's what they say, there's no cure. My friends, that's the beauty of homeopathy. When they give up, that's when we start. Do you understand that that's how this works? Because he didn't start with the homeopathy, he started with a surgeon. And I'm not saying that I believe in surgery in many situations. I really do believe it can have great value. But when they give up, enter homeopathy, my friends. We can't cure chronic ear infections. What do? We don't know what to do. We just give the antibiotics. It keeps coming back. Enter homeopathy. We can't cure depression. Well, yeah, we'll make you stop being depressed, but now you feel flat and you can't enjoy life at all. You have no highs and you have no lows. Enter homeopathy. That's where this comes from. So all of these people here tonight are of that ilk. We've had it with the drugs that don't act and being told there's no cure. That's ridiculous. Of course there's, yes. Now, I'm not going to tell you that we can cure every case. Please don't get me wrong. I don't have a Pollyanna point of view. We can do a lot of good. And it often stuns me how much good we can do. But it's not 100%. We, in certain conditions, like Parkinson's, we can perhaps halt the progression if it started out pretty extreme, I should say. We can perhaps halt the progression with the use of homeopathy. Sometimes we can halt the progression and then return it back a little bit. So the person still has Parkinson's perhaps, but now it's not progressing. It's not marching along. We're moving it slower, calming it down. Now, when it comes to infections, we often see complete resolution. Ear infections, lymph nodes, sepsis, conjunctivitis, strep throat, otitis media, etc. Okay. Yeah, I'm so glad. See, this is what's so good. Perfect. I've been taking Eclolava and it hasn't helped the infection. And do remember, my friends, some of these infections, especially if they're bone infections, can take some time. But what you're doing is watching for a shift. What kind of shift? The person has a little more energy. They don't have the sensations they used to have. They're sleeping a little better. We're looking for peripheral or satellite sensations and conditions to start softening, and then we know that the medicine is acting. We keep carrying on and carrying on and carrying on. I was giving my hubby Hypericum and Eclolava after a second stage of the tooth implant process, and it has helped. So what I always say is, don't assume that we're done. Watch carefully. If you can go to a dentist that has a sonogram, called a cavitat, where they actually view the jaw, the mandible, maxillary with with a sonogram, then they can really see what's going on. It's very hard to see with a good, even with a good X-ray. All right, we're helping each other. I love it. I love it. It makes me very happy to see this. That's what this is about. Not only Monday Night Live that I do every Monday night, I've been doing for, I think, 14 years now, but also in my gateway to homeopathy classes, study groups, I should say. Those study groups, and many of the people here run these study groups. If you ask, well, I'm going to leave in a little while, if you ask who's running a study group, please put your name in there and tell them that you've got a study group coming up for Gateway. And those people who are new can join in. Mindy says, Dr. Dorothy Shepard, one of my favorites, used calendula tincture mixed with water for rinsing things to keep infection away. I started rinsing my mouth with it, and it has helped a lot. Yes, mouth infections. That's for after dental work. Which potency of basilinum for sinus infection? Well, I don't think of basilinum for sinus necessarily. Okay, let's see if I've got anything else. My husband has a driveline exiting, his chest. He has had trouble with it. I have been using Hypericum 200 and Arsenicum 200. It cleared for a month, but has come back and I can't get it under control. I'm not going to tell you exactly what to do, but I am going to urge you, because I can't take cases here. I'm sure you can understand that. I urge you to consider the antibiotic course. Joette's Learning Center, scroll down and go to antibiotics. Or take the course with someone, who may be teaching it now. Okay, my friends, I think I've answered your questions. I've gone a little over our time. It's so wonderful to see you all. We will carry on next week, as always, and I say, yes, I'm going to Mighty's right now, and we'll go to my Mighty's. If you're here, stay on. And then I'm going to, you're going to do that, right? Okay, I'm going to say good night to you, Happy Advent, and then Merry Christmas coming up.